Thank you very much for joining us today for Transforming the Healthcare Business AI. And on behalf of the chairman and the Capital Club board, I would like to take this moment to thank all the people that collaborated for this event to happen today. And many of them flew today or last night from all the way from Taiwan. So I would like first to thank Avita. Avita is the medical group that organized the events. And we have two sponsors today. So one of the sponsors is Axel. Axel is the quality control. It's part of the Avita group, which is also part of the Lumistar, which is a big high-end laboratory for stem cells in Taiwan.
Well, ladies and gentlemen, good evening. My name is David Wong from Taiwan, and I have brought over a very interesting device for you to try. It's back in the sofa area. And first of all, it's a device that was used as a secret weapon for gymnastic team. Yeah, that's in 2008. Okay, so all gymnastic team, they won gold medals. The men and women's team, they use it for speedy recovery from injury and also to bring up their energy level. We have created a device that put 5 different kind of energies all together. One is far infrared, the good light from the sun, from 4 millimeters and to 12 millimeters is very important for our blood circulation. It sync with the water in our blood, very important. So far infrared, and try to enjoy the sunlight whenever you can, but not for too long because there are other, harmful to our health. So we take the good part, put it in the device, and then we put electrostatic potential. It's very popular in Japan. It's like electricity. Put electricity into your body to energize your body cells. It actually bring up the cell membrane, means make the body cells more active. Okay, it has more energy, so it's more active, but in a very mild and harmonious way. So you don't feel the pain, but you've been charging, your body is charging when you use the device. And then we have PEMF, the third energy, hidden inside of this device. And then we have thermal energy. When you use the device, you will feel the heat is very comfortable, especially in winter time. Of course, you don't have the very harsh winter here, but it's still good for your blood circulation. And negative ion is released from, we are generating the electrostatic energy. So 5 energies all together, and they are directed by Chinese acupuncture technique. Use the device, try to prevent disease from happening so you can save your medical expense. So with the device, it's really for wellness, to look after yourself, look after your whole family members.
Thank you very much for joining us today for this important conversation on AI and healthcare. We've got a distinguished panel here, and I think this is a very important topic because healthcare is probably the ultimate test for AI to improve human life. According to a recent Harvard study, AI is expected to reduce the cost of diagnostics by 50% and improve the service and the deliverables of AI by 40%. So quite an impressive promise here.
I would like to thank the Capital Club for the invitation to this panel. My name is Atif Braiki. I'm the Chief Digital and AI Officer at Dubai Health. Dubai Health is the public health system in the Emirates of Dubai. So we run and operate all the government healthcare facilities, and it's an integrated academic health system. So we have also medical school, research centers, and a philanthropic foundation that is focusing on health and health sciences projects. AI definitely is one of the key future change maker that is going to transform healthcare, not just globally but also in the UAE. If you look at the landscape of UAE in general, at the federal government, there was a chief AI officer who was appointed a long time ago. And then there were various AI policies across various sectors. In healthcare specifically, the healthcare regulators in the UAE published AI policies to make sure that, when we introduce AI to healthcare practice, that we introduce it responsibly, that it is safe for the patient, and we put gate checking and controls. I would say the expectation and the hype of AI changed a lot in the last 24 months with the introduction of ChatGPT and the wide adoption of ChatGPT among the consumers. And that's why we have seen the acceleration of appointing AI officers, at least in the government of Dubai, and healthcare being one. Dubai Health Authority has already appointed a chief AI officer, and at Dubai Health as an operator, I was appointed to initially look at what are the potential opportunities of AI, but also at the same time how to balance the risk that AI can bring to the healthcare practice. How do we responsibly and ethically, and also when we introduce AI, we ensure that the patient safety. Few examples have already been seen in the healthcare sector where AI today is embedded within electronic medical record systems, and it can give different predictions and insights for the clinicians. However, how do we validate these AI models? How do we ensure that they are properly trained, and especially to our population? And even after we introduce it to the clinical work, how do we integrate it to the clinical workflow so that the clinician is responsibly using AI to make decisions? And once the clinicians are comfortable with using AI, how do we make sure that when they don't become overly dependent on AI, especially that sometimes AI, as it gets trained with additional data, it can start giving wrong predictions. So if you don't do checkpoints of validation, how do you ensure that clinicians don't start to become heavily dependent? And if it's giving wrong indication, these clinical decisions might be based on wrong insights, which can harm patients. So I'd say at least from healthcare operators, we focus a lot on how do we safely introduce AI to the clinical practice. From the regulator, definitely they need to balance between the speed of innovation and, again, how do they allow healthcare providers to responsibly and safely introduce AI in the healthcare practice.
Thank you, Atif. Thank you. Amit, from a Microsoft point of view, you're providing an infrastructure for AI and a lot of use cases for the healthcare industry. Give us a little bit of a background of what Microsoft is doing and what's the view globally, but also regionally here.
Bashar, thank you, and good evening, everyone. Amit Batra, I lead healthcare for Microsoft here in UAE. And building on to what Bashar is asking me and what Atif just mentioned, we definitely have a responsibility to provide secure, scalable infrastructure to the region, not only to UAE, but also to the US. I personally feel blessed to be in the UAE at this time because when I see the diffusion of AI across private and public sector, and when I compare notes with my colleagues globally, by far they're learning from us. I know many times you read this in the press and the media, and sometimes you might think it's a hype, but behind the scenes, Atif and his colleagues, they're pushing the envelope on leading use cases, but at the same time, with responsibility, with security embedded. So I'm proud that we are serving the UAE, and it is becoming a model for the region. Talking from an infrastructure perspective, historically, US and the West has fairly leading infrastructure to deploy AI workloads, but many of the large tech players have prioritized UAE as a market where infrastructure here in UAE will be second to none. So many capabilities that took years to get to UAE or other countries around us, it's not going to be the case for UAE. We are fast tracking a lot of capabilities right to US to provide that infrastructure that is highly secure, scalable, and can actually process the demands of AI workloads. For those of you who play and dabble with AI, you would know that the way the processing works for standard workloads, it's not the same for AI. your multiprocessing, you need GPUs, you need very different architecture to support that. And we are making those investments to make sure that AI can continue to scale in UAE. The last point that I'll make is the topic of responsible AI, especially in healthcare. You can experiment in retail, you can experiment in marketing, but you can't experiment with live patient data. It impacts lives. At the same time, with AI, you are able to take synthetic data, test your models, test your hypothesis before you go into production environment. So there is a channel that AI provides us to actually fast track innovation, even in healthcare.
Brian D. Francesca, I'm the Group Chief Executive Officer of Sharq Healthcare in beautiful Fujairah. The first thing I did was establish an Office of Systems and Process Engineering, because this is our current globally biggest weakness. Over 70% of digital transformations fail. $100 billion has been invested in digital health in the US with just about no return on investment. And most of that is because of, if you think back to the light bulb in 1879, right? If you walk into someone's house in 1879 in Baltimore, where I'm from, with a light bulb, what are you going to do with it? Put it in the IKEA lamp and plug it into, no. This is an AI chatbot, right? They're wonderful, they work. But the systems, the workflows, and the processes, that all needs to evolve. We can't just, so where it's going to go, this stuff is magnificent. It is orders of magnitude more transformational than electricity. But we're at the front end of the in-between period. And once we start addressing regulation and infrastructure, but when I say infrastructure, I don't mean the wires and things. I mean workflows and processes.
Driss Lahjouji, I'm the Managing Director of Dalus Consulting, which is a boutique consulting firm specializing in innovation and digital transformation. AI will play a prominent role at every step of the healthcare journey, whether to keep people healthier, whether to keep them live longer, whether to help them recover faster and better, but would also play a significant role from a provider and a payer perspective. Today, one of the biggest challenges of payers is the operational efficiency, is the operating rooms that are being idle. It's the wastage that happens in terms of workforce, but also in terms of like medical equipment.
Atif, going back to you and going back to the journey you had not only in Dubai, the Health Authority, but also before that with Malafi, the challenges around data quality, bias, algorithms, trust, and lack of skills. As a chief AI officer, how do you put all of this together to make sure that you're delivering quality solutions to the healthcare industry and providers?
Yeah, so prior to being in Dubai Health, I was in Malafi, which is the Health Information Exchange in Abu Dhabi. It's a platform that connected all the electronic medical record systems across all the facilities in Abu Dhabi. Prior to that, I didn't have experience with health IT. I was working in digital, but in various domains. And what struck me is the complexity of interoperability, just moving data between systems. I would expect that would have been an easy solution. So that was the first challenge, that just extracting data, especially from some big systems that you would have expected that they would be open and they can exchange data easily. So there was a lot of technical limitation in terms of movement of data. Second key challenge was really blocking of data. So people sharing data was not, let alone, it's not easy. Just for people to agree of, okay, if I'm sharing data, what does that mean in terms of liability, patient safety, privacy? So putting a framework for that exchange of data was a key challenge. Then data quality and data standard. Recently, I was just reading a report about clinical notes that are embedded within our medical records in all the facilities. And it was saying that 1 out of 4 medical records of patients have mistakes in the clinical notes. just last week, I was reading a clinical note of a colleague, extracted from the system, and we were just going through the clinical documentation. We saw a lot of mistakes. So these were real challenges. That you have quality of data, you have interoperability, and you have concerns on privacy and information blocking. So what really helped Malafi in Abu Dhabi is to have a universal participation, a mandatory participation, but that's mandated by the regulator. And that really helped driving the program changes across the different healthcare facilities to exchange data, to ensure that the data is not being blocked. When it comes to data quality specifically, which is a challenge today in healthcare, I think it's a journey. You need to continue monitoring the data quality as it flows. And as you go, you start putting corrective actions to improve as you progress. The last thing is around workforce and skill set gap. It's a major challenge. I don't think only in healthcare, in all industries. It's a challenge when it comes to data science and AI experts. But specifically in healthcare, you have the challenge of getting people who have advanced skill set in health IT, especially in AI and analytics. But also something as basic as clinical informatics. So how do you get also clinicians who can bridge the communication gap between the technical people and the clinical world? It's a major shortage, especially here in this region. I know that there are various groups who are working in improving the digital health workforce in the region, and it's an area that we need to continue improving and working with different institutes. I would say specifically at Mohammed bin Rashid University of Medicine and Health Science, we're a medical school. We have already introduced digital health within year one medical students to make sure that we equip them. With that, we're already working in partnership with few institutes to introduce clinical informatics program here in the region and to start increasing that awareness of these important skill sets in the market.
I think it's very much about people and talent before technology. And that's something that's very important. And the UAE has been very much focusing on this by appointing chief AI officers and making sure that the human capital that's required for a successful transition into an AI economy is actually there. So Amit, technology is great. Technology is there. You wanted to talk about the responsible use of technology. And when we talk about the healthcare industry, we talk about many elements. Some of them are cultural, some of them are economic, but many of them are really related to regulations, ethical use of technology. And how is Microsoft approaching that? And what's the level of collaboration that we have in this part of the world? I know that Microsoft made a big announcement in the UAE with G42. And as part of the announcement recently, there was a Center for Responsible AI based out of Abu Dhabi. And I think it had a local but also a regional mission. Where is healthcare in this aspect?
I think those are multiple questions layered in, so I'll try and peel those off. If I forget, please guide me.
I'll remind you. I know where you live.
So I think starting with responsible AI, a few years ago when Microsoft started this journey, some of our visionary leaders could see that this resource, this tool will be challenged. At the same time, there will be characters who would try and misuse the tool as it is with any tool. So our president, Brad Smith, started the Responsible AI initiative across the world. We had 5 principles, and I'll try and remember those. One of them is ethical, fair, trustworthy, transparency, and the last one is scalable. That we are able to go through all of this and make sure that any solution that we provide passes this framework. And not only as a PowerPoint pretty presentation, but within Microsoft, we have created a review board. So any leading AI use case that we pitch to our clients has to go through our internal approval first. But only then we can say Microsoft supports this use case. And you can imagine when it comes to healthcare, we are absolutely grilled on the use case. And many times when we envision leading use cases with our clients, we actually have to first really get approvals from our internal stakeholders who compare that across the frameworks and then give us guidelines, and many times even tell us to not implement. Because right now, we know the technology is in its infancy. So maybe you could do a POC with synthetic data, but to get that approval on production data, we have to make sure that the tools that we are using are actually designed to handle that. So in summary, we created the framework. We created an internal review board to process every leading AI use case. Only then it comes out. The second piece, very quickly, I want to touch upon on what Atif mentioned about Malafi. There are two fun facts that some of you might not know about Malafi. It's one of the very few highly successful HIEs globally. HIE initiatives started, 7 or 10 years ago, and very few have been successful, either because they were lacking the consent, they were lacking sponsorship from the leadership, or stakeholders actually agreed to collaborate. Again, in UAE, all of that was possible, and today we have a data source that is so rich. Of course, it needs, it can always use better quality, and it's a journey, like Atif mentioned, but we are fortunate to have that. Lastly, because of that initiative that happened 7 or 9 years ago, I want to share with you what are the leading use cases that we are thinking about, and some of that is literally chatting with your data in natural language. With today the LLMs we have, of course you can make dashboards, you have all kinds of tools, but then it's really hard to ask very simple questions like, how many patients are in beds today in Abu Dhabi? Like, if you have an emergency and you need to ask a simple question, it'll take us a day to figure out that answer. But today, we have the tools where we can make this possible within minutes or within seconds. Lastly, we are also seeing on the flip side, what's the benefit to the patients, right? They provided the consent. They're letting us collect that data, but what's the potential for patient engagement? And what we are seeing is where you have a patient assistant. You could talk to a patient assistant, a patient could talk to an assistant and say, I need to schedule an appointment. I know today we can go in an app and click 6 buttons and say, oh, there was an error, right? And it just frustrates us next time you pick up the phone and you call the clinic. Wasted technology, but we have that chance to actually solve that for patients who cannot click. To give them access so they can actually talk to the data and get going about their day.
Thank you, Amit. I'll come back to this question on what AI can be rather than what it can do. So hold that thought. Brian, do you have a chief AI officer? Do you need a chief AI officer? Given all these dynamics around regulation, technology, we heard about shortage in skills and capabilities. How do you take all these use cases and implement them in a live clinical environment? And what are the risks and steps to go about that?
Yeah, that was another multi-level question. He's getting us with these. No, we don't have a chief AI officer. And I think one of the key challenges is going to be defining who actually, what would make an ideal chief AI officer. I mean, I've read extensively on this, right, and what I keep hearing is probably the best candidate to be a chief AI officer would be an English literature major. And that is not a joke. It's probably not a techie. It's probably not a computer scientist. Now, I'm not saying this is my opinion or not, but I keep reading this, and the thinking and the skill sets are different. AI is not about alien intelligence or whatever you want to refer to it as. It's not just about the technology. In fact, it's almost not at all about the technology. It is an entirely different way of thinking and comprehending and working, and that's not a coder. Now, of course, data scientists are important, and all these people are important. But actually knowing what an ideal chief AI officer would be presently, I don't know. I think if you go into most of our our organizations, the management of information in its broader sense really isn't happening. You have an IT guy that's in charge of the servers and the switches and all these things and all that. But how their understanding and use of data, we're probably using, I'm talking we broadly, 10% of our electronic health record capacity. We're barely even scratching the surface. And this is with our current CIOs. So what this whole new area is going to look like, we're still learning it.
Thank you. Driss, give us a view on the future. With all the infrastructure, the regulations, the innovation that we have here in the UAE, first of all, do we need the chief AI officer? And how do you see the healthcare industry transforming?
I don't think we really need a chief AI officer. I think what we need is more an efficiency officer, taking into consideration the patient from the beginning, but also the doctor, the nurses, and the entire ecosystem. AI is only an enabler, like other technologies, like digital twin, AR, VR, and you name it. What I see the future going is, one, I think the legislation has to follow. We would need to have more and more software as a medical device. We need to have legislation in place that would test and validate those solutions before going to market and being adopted by a broader, larger population. I think the use cases will start filtering based on the one that deliver against the promises, the one that deliver value to the end user and to the ecosystem, and the one that have an ROI associated with them. Like with any technology, there is a hype at the beginning. We are testing, we are POCing, but at some point in time, healthcare operators and payers, they will ask for value. What is my ROI before I invest in this use case? It may marginally improve the outcome or the efficiency or the patient experience, but how do I monetize it? And who pays for it?
What does the chief AI officer do?
Yeah, so UAE or Dubai specifically, is appointed chief AI officers across the different government entities, and it's a role. It's not a dedicated position. So, in addition to my responsibility of digital and information officer role, what the Dubai government wants is that to bring that one person accountable to start putting a plan for the organization in terms of what does AI mean for different entities. Because AI definitely has a lot of opportunities, but if it's not responsibly introduced, it can be very, very dangerous. So instead of just leaving it open, they said, okay, there must be a chief AI officer, and everyone is given a mandate in terms of seeing how do we responsibly increase the adoption of AI. There is an aspiration of increasing the adoption of AI. There is definitely opportunity, but how do you balance it also to introduce it responsibly within the entity's operation? I know that even in the US, at the federal government, if I'm not mistaken, they also appointed chief AI officers across different federal entities. So there are many countries also who are already starting to see the value of just defining a role, not a dedicated position. I don't think a chief AI officer would be very, very busy if they're just appointed to do an AI strategy, but at least to initiate putting a chief AI officer. The way that we're taking it, for example, at Dubai Health, is now we're forming a work group. People coming together across different specialties, as Brian said. Sometimes you need to get people who are not technology, people at all. When it comes to legal and compliance, when it comes to clinical use cases, is getting the clinicians, operations. How do you bring all the people together so that they can start thinking in terms of how do we introduce AI within our operations workflows and our clinical workflows? The aspiration at the next step is that we're going to be establishing an AI lab. Once we bring that group together in terms of how do we create a lab so that we can do rapid experimentation, we fail fast, we learn so that we can succeed in the future. And the aspiration in the future is that once we start proving the value of AI, and of course having business case with the return of digital investment, is then potentially create a center of excellence to start embedding AI across all our day-to-day operations. I mean, Microsoft is focusing a lot on, the co-pilot and how that is going to be transforming the way that we're doing standard office productivity tools. How do we embed AI so that we can become more productive? And of course, there are different use cases across the clinical and clinical operations.
I've seen the role of Chief AI Officer become more important across industries. We've seen the government in Dubai, but also the federal government now appointing Chief AI Officers. Because the problem is everybody's experimenting with AI and nobody's getting economic value out of it. The role of the Chief AI Officer is to create accountability across the organization. Just as Atif mentioned, make sure it's done responsibly, make sure the organization is rallying behind it to create a step transformation. AI is not there for fun. AI is there for economic value. And to create that economic value, the organization needs to be transformed in such a way that it creates value around artificial intelligence. And that's why many organizations today are choosing to have a Chief AI Officer who's not the CIO. And in many cases, it's the Chief Transformation Officer who actually takes the organization from one culture, business model to another one. That takes me to the other question, Amit. What AI can do versus what AI can be. And you already mentioned things like AI is your assistant, your tutor, your doctor, your nurse, but also your bully, your spy. So how are we going to transform the healthcare industry thinking about co-pilot and what AI can be for the doctor, for the patient, for the whole industry?
That's a loaded question, and we constantly think about that.
It's not innocent.
It's So I'll share what it can do today, and also a little bit of a peek into the future, where we think it can be doing a few more things. What can it be? Let's build on that. So today, as Atif mentioned, that Copilot is the new tool that Microsoft created. Is a simple assistant. Previously, you could use any kind of search, but this is the search on your specific data that gives you very quick intelligence from your emails, your spreadsheets, your everything on your laptop and your company servers. Very quick Q&A gives you answers. What we feel is that many times you kind of ask the same questions again and again to get you some of the insights very quickly. We're seeing evolution of that into when I say that AI can be my assistant, I just don't want the assistant to come and work when I'm asking it to work. I want the assistant to have the intelligence that once I asked you this question, you're able to do certain actions by itself and give me that this work is done or this work is ready to be done. Should I execute? Right? So we are working on that next model framework, which we call the agents. The agents would be where your work is processed in the background. Like when I come in, very simple, I'll break it down into a simple workflow for daily basis. When I come into the office, I see 300 emails from the last hour, 24 hours that I've missed. And I come in every day today and I say, summarize my email, right? My agent should know that I've missed 25 emails. And it summarizes me and says, Amit, you've come in, you've missed these 3 actions. One of them is critical from Atif. It needs your attention. Can you please call Atif? To me, and then agent should say, do you want me to call him right now? And I should be able to say yes now or within an hour. And the work is executed. That's where we are seeing the next evolution coming in very quickly, which we call the agentic workflow. It's very interesting. And if you apply that to healthcare, we have so many nurse managers coming in and they have their daily rounds. They're trying to create efficiencies for their employees. How can they connect the guidance that they got from their senior management to apply that to the nursing schedules or their leave policies or emergency that's happening in the region? So there should be a quick connect that happens. And this agent should be able to guide us to really fast track the workflow. So that's where we're seeing it can go. Now, what can AI be? I think it's a tool that is diffusing at a very faster rate, and it can become pretty pervasive in everything that we do. I don't have a name for it, but I feel it's going to be everywhere, and it can. I think people would start making their own agents the way they want to.
I think the next thing is agentic AI, yeah? And there was a study in the UK, a recent one, where you had an agent and doctors communicating with elderly patients. First question was, do you know whether this was a doctor or an AI agent? And most of the elderly people recognized this was an AI agent. Do you prefer to speak to the doctor or to the agent? Most of them wanted to speak to the agent and not to the doctor. They found it more informative and empathetic. So it's an interesting aspect, but we are getting to a point where AI can be more to us as humans than what it can do. And before I come back to you, Brian, Driss, agentic AI and having AI as agents, and what does that mean to the future of healthcare? Do we need hospitals as we have them today, clinics as we have them today? How does the future of health look like?
Yeah, I mean, I believe that we still need hospitals, not the way they've been operating today, because the model of care is changing. We are shifting from brick and mortar model to more digital enabled. And you mentioned the example of like elderly patient wanting to interact with AI agent than with like medical doctor. So the future of hospitals would be a hospital that would be AI, and not only AI, but in general technology enabled, where the AI would help doctor perform, like everyone within the ecosystem, perform their job more effectively, but also reduce medical errors. Today, I think it was mentioned earlier that 40% of imaging contains error, and AI can reduce that by 40%. So what it means is that everyone would be more effective as doing their job, and maybe it would give back time to the doctors to play the role of being the educator, of being someone who is empathetic, someone who can spend more time with the patients to educate them about their healthcare when they can interact in a more empathetic way.
Thank you. Recent McKinsey study, Brian, shows that only 60 companies globally in healthcare are doing extremely well, 44% growth every year. The rest of the market is fragmented, hardly making any money, and the whole notion of virtual first medicine has not really picked up. Before we open it up to the... What is your view on the future of healthcare, and how do all these AI-led transformation reshape healthcare as we know it today?
I sincerely believe that in the future, I don't know if that's a year or 10 years from now, that we will no longer be saying telemedicine, digital health, all that. It will be how we do things. But as I said, probably with too many words at the onset, we're not going to get to that until we completely sort out how we work. Most healthcare organizations are process illiterate. They don't employ the difference on Mayo Clinic, which I have no affiliation with, but they're considered a pretty good organization. They have said to me openly, we have good doctors, as good as anyone else. We have great processes. They employ 200 industrial engineers just for process mapping and workflow. And who is one of the leaders in the US and in the world in AI adoption? Mayo Clinic. Cleaner data, sorted processes and workflows. So in this future, we'll get there. But as an industry, we've got a lot of basic housekeeping to do to set that foundation. We're doing it, and Dubai and the UAE is definitely leading most of the world in that area.
Atif, before we open to the audience, what does healthcare look like in the UAE by 2030?
I think I'll agree with Brian that technology definitely is going to be embedded more in the way that we provide care. I'm expecting that more care is going to be maybe shifting from the facilities to home, being it using telehealth or any other mechanism of providing care. But I believe that technology and AI specifically is going to definitely be contributing to provide better care. But the foundation, I would agree with Brian, is that if you focus on clinical workflows and processes and streamlining those, technology can then just be a key enabler in providing better care and more care going closer to the consumer at home.